In this video, I'm going to go through some possible nursing diagnoses for anemia, as well as a full care plan for you. We will walk through the full care plan so you know how to pick a nursing diagnosis and complete your nursing care plan for anemia. Let's dive in. Now, before we start, let's quickly review the three major parts to a nursing diagnosis. You have the actual nursing diagnosis, the related to factor, and the as evidenced by portion. Now, we're going to walk through the full nursing diagnosis here, but I also have a free care plan cheat sheet to help you select the best nursing diagnosis for your patient at clinical and prioritize them properly, which is what your instructors are looking for, right? So be sure to get that after you watch this video. I'll put the link down below in the description for you to snag it. So the first part to your nursing care plan is the nursing diagnosis. This is a NANDA approved nursing diagnosis. Now, the best part about this is that it is standardized. This is not something that you have to come up with on your own or create yourself. They are already created for you. You just pick one that most closely represents your patient from the standardized list of those NANDA nursing diagnoses. You can get those from your textbooks or a care plan book if you have it. Now, the second part is the related to factor. The related to section is really where we pull the pathophysiology into the picture. Now, essentially, what is happening inside the body with whatever disorder the patient is experiencing and why, based on that pathophysiology. That's what you'll want to put here in this section. Now, the third portion of the nursing care plan is the as evidenced by, or the AEB section. Now, this is where you start to really apply it to your specific patient and the signs and the symptoms that you are seeing in them. So that is the nursing diagnosis section, which is the first part of your care plan. And I actually just did a whole video on how to pick that best NANDA nursing diagnosis for your patient. So be sure to check that out right here after you watch this video. So let's walk through some possible nursing diagnoses for anemia. This could be things like fatigue, ineffective tissue perfusion, and impaired gas exchange. Now, again, these come from that standardized list of NANDA approved nursing diagnoses. I am not making these things up on my own, my friend. The key here is making sure that you are picking ones that are most applicable to your specific patient and their current situation, right? So for anemia, there could be three options for your NANDA nursing diagnosis for your care plan. The one we just walked through. You do have to make sure that you are choosing the ones that will fit your patient the most specifically. But you do select from that standardized list of approved nursing diagnoses. So don't make them up on your own. Just choose from that list. So those could be three possibilities for your nursing diagnosis for your nursing care plan for anemia. Now, that's how you come up with the first part of that nursing care plan, right? The nursing diagnosis. Pick the most applicable nursing diagnosis from that standardized list, okay? And make sure that it applies to your specific patient and their current condition. Then next, you can move on to the second portion of your nursing diagnosis. The second part is the related to section. This is where you dive into what is actually happening with your patient. Now, the key here is all about the pathophysiology, okay? What is going on in the body? So with anemia, there is a decrease in the amount of healthy red blood cells and or hemoglobin in the body. Now, why is this important to have enough red blood cells and hemoglobin? Well, think about what red blood cells carry throughout the body, right? They carry oxygen. So if there aren't enough healthy RBCs or hemoglobin, then the body could potentially be low on that oxygen circulating to the various organs of the body. So think back to your patient's condition and think through what is causing it and then the pathophysiology of it, pathophysiology behind it all, and that will be your related to section. The key portion with the related to part of your nursing care plan is to really make sure that you are applying it to that pathophysiology of the disorder and that it applies to the nursing diagnosis that you chose. Now, onto our third part of the nursing diagnosis. This is the as evidenced by portion. This is where you will pull together the signs and the symptoms that you are seeing in your patient. So you've already connected your nursing diagnosis to the pathophysiology of the disorder, and now it's time to really take it one step further and connect that patho to what your patient might be clinically looking like. What signs and symptoms are you seeing? So how is your patient presenting? What signs and symptoms do they currently have that relate to that particular nursing diagnosis? So in the case of anemia, this will largely depend on what type of anemia they're experiencing. So iron deficiency anemia is going to present different from sickle cell anemia, but that is why you personalize the second and the third part of your nursing diagnosis, making sure that what you are seeing in your patient clinically is represented appropriately with your nursing care plan. So some examples of symptoms that you might see and could use as evidence bisection are fatigue or lack of energy, maybe shortness of breath or pain or pale skin, decreased H&H, hematocrit and hemoglobin, and an increased heart rate. Now these all have to do directly with what we understand is happening in the body with anemia. There aren't enough healthy red blood cells to circulate the oxygenated blood, so the body is trying to compensate for that. Now I know this sounds like tedious work, but think of care plans this way. They help you to make connections and practice the critical thinking that will be necessary when you're caring for your patients and on your nursing school exams. So take the time to really dive into the symptoms that your patient is experiencing and really connect them back to that pathophysiology here, okay? So this is so crucial to really fully understanding what is happening with your patient and the why behind it. Your nursing care plan is your chance to deepen your critical thinking skills and really dive into what's going on with your patients. So now that we've got the nursing diagnosis down, let's walk through some possible patient goals and nursing interventions that you might include for your nursing care plan for anemia. That way, you'll have a complete anemia care plan to use as an example for when you write your own. Now, I will be taking these from the anemia care plan that we have inside the NursingSOS membership community, the NMC. So if you want tons of care plans, study guides, videos, and cheat sheets to help you pass nursing school, be sure to check the community out, my friend. You are going to absolutely love it. I will put a link down below in the description for you to check out all the details. So some possible patient goals that you might use for your care plan for anemia could be things like the patient will have an improved H&H level, hematocrit and hemoglobin. The patient will have an improved tolerance of physical activity. The patient will participate and perform all ADLs, activities of daily living, with minimal assistance, or the patient will maintain a stable respiratory status without any dyspnea. Now, a key thing to know about patient goals is that they should be written as the patient will. Now, these are all focused on goals for the patient specifically. This patient goals section is focused on the things that the patient will be doing, the goals they want to achieve, which now brings us to the next part of your nursing care plan, which is the nursing interventions. Now, again, I'm pulling these from our anemia care plan inside the NMC. So be sure to check that out if you think it will be helpful for you. So some possible nursing interventions that you could include in your anemia care plan, these could be things like the nurse will monitor the respiratory status and perfusion. The nurse will continue to assess the H&H values, the hematocrit and the hemoglobin. The nurse will educate the patient on iron supplementation and nutritional requirements. And the nurse will administer iron as ordered. And the nurse will encourage periods of rest. So this section is all about the things that you do as the nurse, what you will be doing to help your patients. So these are all written as the nurse will, right? These are things you will be doing. Now, the last part of your nursing care plan, this is the evaluation section. This is basically just the nursing assessment all over again. You'll state whether or not the patient met their goal, and if the goal wasn't met, you'll write out what progress they did make, what progress they made, what changes you may need to do to their care plan to help them reach their goal. And you'll give your recommendations for changing the care plan to improve the patient outcomes. Now, if you want more tips on passing all of your nursing care plans and writing them easier, be sure to check out this video right here where I walk you through how to do all of that and break it down for you step by step. And if you loved this video and you want more care plan videos like this one, write love in the comments below. Your feedback is so helpful for me. It really helps me to know what videos you want more of. And as always, my friend, go become the nurse that God created only you to be. And I will see you over there in that next video.